Horses are noble creatures and superior to us in virtually every respect. Despite this, horses too have their proverbial Achilles heel, as most injuries are sustained in the area of the tendons. In order to understand the frequently very slow healing process of horse tendons, it is first necessary to know something about the anatomical fundamentals. The skeleton of the forefoot consists of 2 rows of small bones flanked on either side by the splint bones and the cannon bone. From top to bottom, these are followed by the sesamoid bone, the first phalanx, the second phalanx, and the third phalanx. On the bending side of the cannon bone are 3 distinctly separate tendons. The tendon of the superficial digital flexor muscle, the tendon of the deep digital flexor muscle with the accessory ligament and the suspensory ligament. On the front side of the cannon bone is the common digital extensor muscle. But how does a tendon become damaged? The tendon tissue consists above all of densely arranged collagen fibers known as myofibrils. A number of these tendon fibers joined together form a tendon fiber bundle surrounded by a jacket. If a number of these bundles of tendons join together, you have a tendon. If the extensibility or stretch limit of the tendons is exceeded, for example as a result of stumbling or twisting over, then individual tendon fibers, bundles of tendon fibers, or even the entire tendon can tear. As a consequence of the low blood supply at the tendon, healing problems result, and instead of newly formed longitudinal fibers growing into the wound tissue, connective tissue type scars result. A vicious circle starts, as the newly formed scar tissue is by no means as elastic and resilient. Is there a way of accelerating the healing process and preventing scar formation as well as eliminating chronic tendon injuries? A new and innovative therapy containing the patented active ingredient STABHA, developed especially for soft tissues, gives rise to hope. Using a special fan-shaped technique, this substance is injected peritendinously through an insertion in 3 phases, not into but instead on and around the injured tendon. After the insertion, 1/3 of the content of the syringe is injected each time during retraction of the needle. Shortly before the needle is retracted from the insertion point, it is rotated. The needle is guided back in the direction of the tendon, and on retracting the needle, a further 1/3 of the content is injected. The final 1/3 of the substance is emptied on final retraction of the needle. A gel-type structure is formed, known as a fibrin complex, which wraps around the injured tendon and stabilizes it like a kind of inner strapping. In addition, the substance actively affects the traumatized tissue, thus accelerating wound healing and greatly restricting scar formation. Complaints such as inflammation, swelling, and pain are distinctly reduced. This operation is repeated after 2 to 3 days and then again after 4 to 6 weeks, thus ensuring that the tendon becomes more resilient again and the horse is free of pain.